Hello, everyone. Welcome to today's webinar. We're so glad that you could join us. So just before we have our introductory remarks, we are sharing a small Menti just so that we can get to know each other a bit better. So I am just about to start sharing my screen and you'll be able to see the code to use on menti.com. So it's just a survey. Log on to your browser, go to www.menti.com, and then put in the code that you're going to see in a few seconds, and fill in the survey, tell us what you study or what's your profession, and we will begin our presentation in a few minutes. Thanks again for being here. You should be able to see my screen now. Yes, so just log on to Menti and, tell us what you study or what's your profession, because we are expecting, a lot of students this afternoon, a lot of professionals as well. So feel free to share with us what your area of study is or your profession as well. Again, thank you so much for being here. We have 9 responses so far. Go ahead, don't be shy. Log into www.menti.com. Use the code 593704 and tell us what do you study or what is your profession. Thank you so much. We'll keep the survey on for a few more minutes. So, tell us. We're here to listen. Wow, this is amazing. We have such a diverse cocktail of professionals and students. I'm seeing 55 responses and counting. Keep them coming in. We see MBBS. I can see some nursing students. I can see some final year students. Congratulations. I can see some who are studying physical therapy. I can see quite a number of vets. I can see someone studying chemical engineering. Wow, that is impressive. Thank you for joining us. Environmental health. We have medical students from India. We have, who else? We have doctors. We have clinical officers. We have interns. This is absolutely amazing. I wish we could all meet in person, but soon in due time. But for now, I am so glad and we are honored that all of you could grace us with your presence here. And yes, this is a lovely array of professionals and students as well. Thank you so much for joining us. I will now hand it over to my colleague to give introductory remarks.
Good afternoon, everyone. My name is Simon Oteba from Moi University, the School of Public Health, and I'm taking a Bachelor of Science in Environmental Health. I'm representing the Students on Health Innovations clubs in Kenya, and I'm glad that we are all here today. So I'd like to take this opportunity to welcome all of you to this session. We are having a diverse team of students and professionals from all over the globe, local, regional, and international, represented, and we have our speakers today with us. That's Dr. Kirui and Dr. Richard Ayah. So this session has been organized in partnership between the Medical Students Association of Kenya and the Students One Health Innovations Club in Kenya, represented by Moi University and the University of Nairobi College of Health Sciences and the College of Agriculture and Veterinary Sciences. We have Daktari Online as partners and International Federation for Medical Students Association. Now, a few instructions for you, all the attendees. If you have questions, you can please post them on the Q&A box. If you look at your screen down there, you'll see the Q&A box. Please channel all questions through that. And then if you have any comments to make, you can use the chat box. Then when sending your questions, please mention your name, institution, country, and to whom your question is directed to. Also, we'll provide feedback forms at the end of the session. Please fill them. And then this session will be recorded so that you can be able to access it later. And then if you need to speak or make any comments, you can kindly raise your hand and then you'll be given the opportunity. So the organizing team, that's MSAKE and the Students One Health Innovation Clubs in Kenya, are also glad to provide to you an amazing opportunity for all of you to be part of a small working groups. The vision of these small working groups is to create an awareness on emerging zoonotic diseases in the past and present among students involved in health, and to further educate them on the importance of the three major components of One Health triad in preventing future outbreaks. So these multidisciplinary teams of students will consist of faculty members, mentors, and they will be involved in developing informative document containing credible and summarized information on zoonotic diseases that have either caused endemics, epidemics, or pandemics, an evidence-based solution that's the One Health, using the One Health approach to ending the future pandemics. So this is an exciting project and it's to be executed in the next 4 to 5 weeks. So towards the end of this session, a link will be provided with further details, and you'll have the opportunity to apply to be part of this amazing team. Now today, we are here. I want to introduce to you today's topic, the One Health and COVID-19. So what's the One Health concept? So this is a holistic, collaborative, multidisciplinary approach to the practice of health. This approach recognizes that the health of humans, the animals, and the environment are inextricably linked. So it involves disciplines within and outside the health sector, the One Health triad, working towards the optimal health. So here, as future global health leaders, we all need to embrace this One Health approach, owing to its crucial role in tackling the emerging zoonosis and pandemics, and those that are yet to come. So the fight against coronavirus disease has proven to us how important it is to work collaboratively. So today, ladies and gentlemen, we are privileged to have two speakers talking about One Health approach COVID-19. Without any further ado, I would like to introduce to you our first speaker, Dr. Gilbert Kirui. Dr. Gilbert Kirui is a veterinarian with interest in One Health approaches to management of infectious disease, population, veterinary medicine, sustainable animal health, and poverty alleviation in livestock-dependent communities. He is currently a lecturer at the Department of Animal Health and Production, Masai Mara University, and has been a part of teams coordinating training of current and future workforce on One Health approaches, development of curriculum for antimicrobial use and resistance, as well as the One Health approach to management of infectious diseases, among others. Dr. Kirui is a member of the Veterinary Emergency Response Unit in Kenya, VERU, through which he has participated in control of infectious diseases at the human-livestock-wildlife interface. He has participated in research projects on One Health medicine, disease mapping and modeling, risk factors and ecology of infectious diseases, and impact of infectious disease on low-income communities with livestock-based livelihoods, among others. Dr. Kirui graduated from Faculty of Veterinary Medicine, the University of Nairobi in the year 2003, where he holds an undergraduate degree in Bachelor of Veterinary Medicine. He has a master's degree in veterinary clinical medicine in the year 2012, and he is currently pursuing his PhD in veterinary clinical medicine. So Dr. Kirui today will be presenting on the One Health approach, management of pandemics. So welcome, Daktari. You may take the mic. Thank you.
Thank you very much, Oteba, for that very long introduction. I must say you've done quite a good job, and welcome all participants, fellow presenters. Today, we are covering quite an integral topic for management of pandemics, especially utilizing One Health approach. I think the introductions have been given. The main objective for this presentation will be to create awareness on One Health approach with reference to the current pandemic being experienced globally, which is SARS coronavirus 2 or COVID-19. The outline will be to just give an overview, and I'm happy that we have had an introduction of One Health concept to cover a bit on pandemics and One Health approach, and to look in summary on application of One Health approach for COVID-19, looking at the justification, a bit of challenges and areas of improvement, and that will have sufficed for us today. So when you look at One Health as a concept, it has for a long time been on the background, but currently it is gaining significant importance, especially when you consider the fact that it gives a leeway to focusing on multidisciplinary and transdisciplinary approaches. I'll just try and hide my meeting control. You will find that working at the local, regional, and national or global levels allows for interaction and working with pandemics, since they don't respect borders, and more often than not, they also require support from all professions. The main goal of One Health approach is actually achievement of optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environments. And this is very critical because all of them interact in diverse environments and they present unique challenges. As an approach, One Health has grown to be formally adopted by EU, Africa Union, CDC, FAO, WHO, OIE, and World Bank, among others. In fact, most of the professional bodies now advocate for One Health approach as a skill that must be gained during training, and that has informed this seminar that we're giving today as part of our webinars. There are other key terminologies that have grown over time, and in its definition may interact with One Health in one way or another one. One of them being global health, that has really focused a lot on part of the aspects of environment. We also have public health, which has really focused a lot on the human health with some interaction with animal as well as environmental. We also have ecosystem health that attempted to give a definition of everything. And finally, one medicine. And there are really much more terminologies that come in to interact with One Health, and sometimes causes confusion. And so when you look at it in summary, then One Health is an approach. It is a way of thinking, so it's a concept. And key among it is the fact that it applies systems thinking approach and applies innovation and critical thinking. It is still a growing concept. Part of the drivers for the need for such a concept is the fact that we have had a lot of infectious diseases comprising most of the global biological threats, and they really affect every part of the world. If we think about SARS coronavirus, if we think about Rift Valley fever, we think about even Lyme disease, which we thought we had controlled, typhoid fever, diphtheria, and one that has stuck with us and given us challenges like HIV and AIDS. But more critically is COVID-19 that is coming in at the time when we are having several other players that you find giving us issues. Now, when you think of pandemics and One Health approach, the key factor here is to look at the epidemiological triad and look at the interactions between the host, the interactions between the pathogens, and the interactions within diverse environments. Now, those interactions within and between each other happen and drive ecological evolutions that influences each of the components to the extent that the host's immunity may be driven to become vulnerable to a pathogen, or the pathogen may become more aware of the host and start adapting to the host through passages and several passages. And once it has established an infection, then is able to maybe change the host or is able to cause a more advanced disease. This has led to several spillovers, and so the need to understand spillover effects and to shift our interventions from the right towards the left so that we start giving interventions way before infections occur. Normally we have the bats on the left, mainly rats and mice, which really amplify and maintain some of the pathogens because they live in close communities. They more often than not defecate and urinate within the areas that they stay and are able to move across several ecosystems as well as birds. These would then keep maintaining pathogens that over time, either using vectors or through increased contact, then would multiply and affect amplifiers who may either be domestic animals or maybe closer relatives to humans, like non-human primates. And in this COVID-19, we saw the pangolins as well playing a key role because of the way they are being trafficked and performing the role of amplification and maintenance. Now, once the disease has jumped to humans, really it has had a more established way and is able now to even cause more infections. And if it establishes itself with ease of transmission between humans or human to human transmission, then really we are at a state where a disease-related disaster is able to happen. Among the drivers for One Health approach has been the understanding of multiple host pathogens who really have the uniqueness of having several or multiple invasion pathways, multiple transmission routes that involve several hosts, and varying success in different species, and thus becomes a danger to the whole community. Now, you will always find that transmission rates or reproductive factor O becomes complex, especially with the different hosts and the way they are presenting or relating with each other. And this has been the case with COVID-19, where there's a lot of debate on what is the RO between the bats themselves, within human beings, in diverse population. One lesson that we could learn is, for example, from the study of Simnombrivirus in the deer mice, which really indicated that deer which are living in diverse environments are having less infection prevalence than those that are living in almost closer communities of deers without much divergence. Could it be because the pathogens are easier to be transmitted, or could it be because there are beneficial interactions that go on to reduce the transmission rate? So when we come to coronaviruses, they have really been commonly involved in pandemics, and the understanding in the agreement is the origin was bats, that the intermediate host possibly is the pangolins. The role of the cats is still debatable a bit, but we do know that trade in wildlife and possibly stresses around the wet animal markets or wildlife markets could be the roles. But it's really the final host who is human, who may be playing a bigger role in disease transmission, especially when you look at sociocultural behaviors and some of the negative habits, such as eating wildlife, and sometimes even eating when they are alive, so that they're able to give blood. And this seems to point to the point that we are having a lot of outbreaks occurring around the time before winter, but that could still need to be studied. Again, utilizing One Health approaches, then it is easy to study the virus across species, and mapping of its structural and non-structural proteins have been beneficial in pointing to the fact that really this pathogen has jumped from the bat to humans, as has been demonstrated as well for SARS coronavirus 1 and Middle Eastern respiratory disease coronavirus. So there is possible increased interactions between the different species. There is possible contribution of stressors around the markets, and definitely drivers relating to socioeconomics. So One Health approach, therefore, then would need to be looked at, as it has given us benefits before in terms of addressing COVID-19. The one great justification has been the fact that COVID-19 has affected each and every sector. If you look at all the Millennium Development Goals, there is none which has been spared. But if you look at the economic projection, for example, for June, which has just been revised by IMF, it is having significant negative impacts that have been severe in advanced economies more than emerging and developing economies in terms of calculations. In terms of livelihoods within those societies, maybe we are having maybe an even greater impact in developing economies, especially if second and third and fourth waves show up. We will therefore then look at probably some of the justifications, and in summary, it is a disease that has jumped from wildlife to humans and has been demonstrated to infect animals in close contact with humans, either in the zoo and as well in homesteads. The big question, therefore, is in our delivery of preventive services, in our screening, are we able to document challenges that are occurring around these interfaces? It has also had great impact on strategic development goals and global markets, disrupting globalization, and probably exposing some weaknesses that are inherent in globalized system. The initial approaches to its control have been outstretched, and now the question is the traditional approach still working? And most of the time, no. We are proposing for an even expansion and increased adoption of One Health approach, so that we draw from research that have been generated over time. For example, studies of coronavirus in the pigs showed us that it is easy to get isolates from saliva and from oropharyngeal swabs, as one of the challenges was actually how to get a swab. It is also good to share experiences. What has worked in developed countries may not work in developing countries, and so it needs to be context specific. It has also exposed challenges in resilience of healthcare, economies, and sometimes even policies, where it even threatens the life of institutions. So indeed, if you look at COVID-19, it has hit on security, on trade, on environment, and on health in ways we had never experienced before. The positive is it's also shown that with tailored interactions and tailored interventions, it is possible to slow the spread, and the famous flatten the curve terminology. But what have been the challenges as COVID-19 has been tackled, or even as the first adoption of One Health approach has been put in place? And one of them has been access to supply of essential commodities, which was disrupted, especially diagnostic kits. It has led to great economic meltdown. There's even limited capacity to respond to the outbreak itself. It has altered access to healthcare for populations. Patients cannot come to hospital directly. They need to either make a call, either to access through telemedicine, and some of them have not grown around the system. It has also exposed the need to develop solutions that are context specific. And this has caused a lot of friction in terms of globalization and travel globally. What will be acceptable in some economies may not be acceptable in others, but then how do we accommodate them? Some professions which are key in service delivery have struggled, and I being a vet, it took a lot of time for recognition of veterinary service as an essential service. Food provisioning as well took a lot of time. Indeed, a lot of the focus was on security and direct healthcare service providers. Most information or guidelines exclude aspects of environmental protection, such as safe disposal of masks. The impact of several hand washing stations within a small area containing soap and alcohol-based disinfectant is poorly understood again. Some rushed early interventions, such as human spray booths, which we saw in Kenya, though practical, did not consider ecological and long-term health impacts. The approach has been largely segmented, affected by disinformation and misinformation, which has been greatly amplified by the social communication tools, Facebook, WhatsApp. And there's also more focus on coordinated but disintegrated context-specific approach. This is starting to be solved now by several research hubs that are multi-sectoral, multidisciplinary, but which are networked, are actually undergoing a lot of intervention. We have seen CGIAR and many other global partnerships as well. So what are the areas of improvement? And in summary, it's really building of resilient healthcare systems and economies to support early detection, to support prevention and control of pandemics. That there is need to redefine workforce that promotes public health. There is a saying that we never thought security person is going to take the temperature of a doctor. That now has been challenged. There is more research focus on understanding disease and pathogens around the triad. And preventive healthcare services should really be expanded beyond vaccinations and access to healthcare. And community education should be enhanced for better compliance. We saw with the opening of some markets, it's actually led to people going back to old habits that again will give us a greater risk of reintroduction. And so as I was walking through this presentation and looking at the way we have always drawn our One Health map, I looked at the fact that plant health has always been left aside. It's always human, animal, and environment. Whereas I think the environment really is the fabric where all of this is playing out. And so my thoughts were, we really need to refocus on plant health in itself. We also focus on human health and animal health, where all this interaction is happening at environments that are diverse in nature and which are also interrelated. And so we need to relook at One Health as a concept and its application, especially with COVID-19, which has been a wake-up call. And one of the drivers has been the fact that some of the professions in their development, in their training, have not really integrated with the rest of the professions that are available globally, and therefore they graduate and do not know how to work together. And I must really thank the organizers of this webinar for putting in place this interaction so that we share together what we are learning, even as we tackle COVID-19. And I will also take this opportunity to, as I conclude, really wish you the very best and give our sentiments, even as you are being affected in one way or another by this pandemic. Thank you very much. And that's the end of my presentation.
Thank you very much, Dr. Kirui. I think few of us have ever actually really understood the concept of One Health, but I think this pandemic is really bringing out the importance of integrating different cadres of healthcare and even different aspects of health, even veterinary medicine and others. So thank you so much for the presentation. My name is Christina Tony. I'm a level 5 medical student from Kenya. I'm part of the MSAKE group that was organizing this. And it is my great pleasure to introduce someone who is a very important person, someone who has a wealth of knowledge, and I must say we are very lucky to have them. So he is a seasoned and respected voice in the world of public health. He attained an MBChB from the University of Nairobi, and thereafter successfully acquired a Master of Science in Health Planning, Policy, and Finance from the prestigious London School of Hygiene and Tropical Medicine, and also from the London School of Economics, University of London. In addition, he has a PhD in Health Planning and Policy and is a Fellow of Implementation Science at the University of Nairobi. He also possesses a PhD in Public Health, and currently he is the Director of the Science and Technology Park at the University of Nairobi. He's also a Senior Lecturer on Health Systems Management at the School of Public Health and the Deputy Director of ARUA at the Center of Excellence in NCDs. He's an avid researcher, currently involved in research pertaining to innovation in health, determinants of health and health systems and NCDs. And furthermore, he has served as a consult for the Ministry of Health in Kenya, for the World Health Organization, for UNICEF, and even for UNFPA. So as you can see, we are very lucky to have him. And in addition, he's also the founder of Classic 105 radio station. It's one of Kenya's major urban radio stations. And during his free time, he enjoys tasteful cooking, farming, and writing. And ladies and gentlemen, help me in welcoming Dr. Richard Ayah. Karibu, Daktari.
Thanks, Christy. I mean, you've just read out my whole paragraph without leaving anything. Thanks very much, Dr. Kirui, as well. It's actually it's my privilege to be with you this afternoon. I think, just like Christina said, a lot of times when you hear of concepts, you don't really understand it unless you meet with others who are practicing it. So thanks, Dr. Kirui, for that. I thought this afternoon that I'm supposed to talk about health systems, and in light of COVID-19 and the One Health approach, I thought I'd talk a little bit about what health systems is and how it fits into the bigger picture. So one of the interesting things, just looking at the slides that Dr. Kirui was presenting, when you look at the bit about, and this is in relation to COVID, when you look at the bit about the human health, a lot of people, particularly those who end up doing MBChB, focus just on the clinical side. And in a sense, when you think about that, that is so, at most it's sort of 16th, 17th century in terms of thinking, that you think that you only need to think about the individual and what disease they have. A lot of those descriptions were being done in the 16th, 17th century. And it's important, yes, but I had a really nice quote from Hippocrates talking about the kind of questions that a clinician should ask of somebody who is ill. And he said that when a physician visits a patient, one of the things that you ought to inquire is by asking both the patient and bystanders, is to ask what uneasiness is the person under, what is the cause of it, how many days has the person been ill, and what food has he eaten. And then a couple of more questions come up after that. And one of them is, what is the effective environment that the person is under? And also, where has the person been? And I think when you think about that in terms of the environment, the interaction, you see that it's not just enough to find out about the disease. You have to figure out the social environment as well as the physical environment. As Dr. Curie so well said, think about the animals around and the plant health around as well. So all that feeds into the human health. I'd like to just share a couple of slides with you. So see whether I can be able to, am I getting that? No. Are we able to see that?
Not yet, Dr.
Are we able to see the slides?
Not yet, sir.
Not yet.
And
I think I have to. Okay, just hold on 1 second. Let me just even get why it's not showing. So I think that's what I needed to see. And now?
Oh, no.
It's telling me that it's refused. I don't know why. Okay. Oh gosh. I'll try again at some point as you just talk it through. Why it's refusing to show me the PowerPoints. What about now?
There we are. Good.
Yes.
Okay,
Yes.
Thanks very much for that. Yeah. So one of the things that when we're talking about health systems, and this is sort of my favorite way of looking at it, we're always looking for data that we can interconnect in terms of predicting what are the outcomes that we're going to get. So one of the slow burners that exists is Kenya's population, and this I think you can apply to any developing country. And I bet it probably looks familiar because you're seeing this exponential rise in the population. And this is from the census from 1897 up to today. And particularly in the last 20, 30 years or so, the exponential bit has begun to show. So even though we're beginning to drop in terms of population growth to about 2.2% from a high in previous decades, it's still very high. So we have this population growth. And so when we think about health systems, one of the real challenges that we have is that because it's at that 2.5% or so, one way to think about it is that every 3 years we have to improve in terms of productivity by about 10%. And 10% productivity is very, very high. So irrespective of what we were doing 2-3 years ago, we have to be 10% better. So it creates real challenges in terms of management, in terms of how we can do things better. And it's one of the slow burners in terms of trying to improve overall health. So we have to be running faster every single year. And it's not just a numbers game, it is in true productivity. So when we think about health systems, this is the traditional sort of WHO building blocks approach. And we talk about the 6 building blocks together with people in the middle. So the people are the people who are trying to improve their health. And everything is geared towards service delivery. So we have to think about the financing. Where does the money come from? We have to think about the data. So what kind of information do we need in order to plan health properly? We have to think about our governance. So how are we best structured to deliver the healthcare that we say we need to? We have to think about where do we get our medicines and our technology. And of course, right from the beginning, when we were talking about who's on the call, we were talking about the human resources. So who's in training and what kind of specialties do we need? Now, one of my interests is with history of health systems. So I've picked up some information, particularly about Kenya, going all the way back to the early 1900s. And it's interesting how it has evolved. So if you look at the reports of around 1900, a lot of it was focused on hygiene. And at that particular point, if you're African, the term was that you're a native. And there's a lot of stuff about how do you get the natives to improve on their hygiene. This is the colonial government. And the concern then was around diseases like cholera, dysentery, and all the disease around diarrhea and so on. And that was kind of the state. And it's disappointing in a way that even in 2020, it's still the same diseases that we talk about. So there's been improvement, yes, but we still haven't really conquered the basic interaction that we have as humans between us and the environment. And it's one of the weaknesses of being a developing country that we're very, very close to the environment. And I think that's why one of the reasons why the One Health approach is so critical to our way of thinking. So at that time in the 1900s, all the way up to the 1950s, 60s, and so on, the medical degree that somebody would get, you do your medicine, and then in order to practice in this region, you'd have to get, you talk about tropical medicine. And so you'd see people with a degree, postgraduate degree, DT, M&H, diploma in tropical medicine and hygiene. And even the school I went to for my master's, that's the name, London School of Hygiene and Tropical Medicine. And in a sense, when you think about it that way, it almost looks like that medicine is different from the medicine you'd practice if you are practicing in Baltimore, Chicago, New York, and so on, simply because the environment there is a bit different. But there's an advantage to that and some disadvantages. I'll just focus on, just say that it's a little bit different, and just to say that this is what we have. So we cannot separate the patient from the environment. And particularly, we have built environment which is present throughout the world. So there are people who live in cities, and there's that bit of the health. And then there is just the general environment, whether it is forests, where animals, we have wildlife. So beyond thinking about the general environment around the home or in the city, we have to think about, so how do we deal with our wildlife, for example, and so on. So I put together this is an adopted thing where we think about the public health side of it and the clinical side of it. And I'd like to just bring this up because of the approach that Kenya is taking at the moment, and there are some constraints to it in terms of how we're managing COVID. And in the middle there is our public health approach, where we have to think about the environment, we think about the agents of disease, and who is susceptible. And I think since the COVID-19 came about, we didn't know too much about it, even though coronavirus has been around in animals and so on for a while. So there are people who knew about coronavirus. There are a lot of people who did not know about coronavirus in human beings, and that's what we've been trying to pick up. So who is susceptible? Now, because of our approach has been more towards the clinical side. So looking at individuals and doing, we're talking about cases. So what the Ministry of Health reports every day are cases. And then from there, it's screening and then trying to do some contact tracing and so on. But essentially, we've taken a clinical approach to prevention. Now, that has some severe limitations in terms of being able to tackle the problem in a holistic manner. And so the preferred method would be to have a population-based prevention. So we'd be looking more in terms of the community determinants, and that's really where the research should be focused. So Dr. Kirui talked about, the history as we know it now. It's come from bats, it's come from animals, and so on. The pathway through into humans, and then we're talking about human-to-human transmission. If we're taking a public health approach, and this is something that we don't really know well, but we have the frameworks for it, then you're talking about modifying the community determinants. And a lot of times when people have been talking about how are we going to manage this COVID thing, they've talked about, say, behavior change, but then not looking at what are the community determinants around that. And by way of illustration, we can talk about the campaign in terms of HIV prevention, where there's been the full spectrum, all the way from individual case management into the community and so on, so that we have the full, we're looking at it from very many different disciplines in terms of managing the disease. So we have the frameworks to be able, from a health system perspective, to be able to look at COVID in a much more holistic way. For example, looking at, say, water supply. So we know, for example, if you're living in Nairobi, about 60% or 70% of the population of Nairobi just does not have a regular supply of water. And it's probably the same for every urban area. And this is not something that is temporary. It is fairly structural, that we don't have enough water. We have had issues with food supply in terms of the quality of food that comes in. And people in agriculture have been trying to set up standards with a fair bit of resistance from the population in terms of why is food becoming expensive? Because we have to meet certain standards in terms of the kind of food supply that we're going to have. I'm involved in some air quality research as well. And I can tell you that we've mapped out, we've got some air quality sensors around the city. And we have some fairly poor quality air on certain days. COVID right now has helped, but it's coming back. And these are the kind of things that over time will change the biological susceptibility. So we've seen some papers published where people have wondered, is there a correlation between the air quality and susceptibility to COVID? So that we have to worry about that. Now, all this has implications in terms of the cost of care, and these need to be inputted into the model of care that goes into managing COVID-19. So it's not just a question of looking at what is the cost of clinical care. We have to look and say, do we need to have measures in terms of air quality? Do we need to change the housing, for example? And one very interesting one is occupational. Now, a lot of farmers, and I guess this is where Ebola comes from and so on, people get, especially marginal groups who are vulnerable, get pushed further and further into forests trying to make a living. A lot of people still under that traditional way of slash and burn. So you're displaced from where you live, you move into a forest and you begin to farm there, not really understanding what is the ecology there and what are the diseases that are there. And this is how we then pull people in. So how forests are managed, literally how a title deed is managed, has some implication in terms of health. And so there's a narrow way of looking at health systems, and there's this broader One Health way of looking at things. And this research has to be intentional. It cannot be that somebody who is doing a degree, for example, in forestry, would maybe study forestry and then not think about the health implication. It has to be guided. And I think that is the One Health approach that we need to adopt in terms of our thinking, that health is central But there are all these dimensions that affect human health. And of course, there has to be a balance between the human health and animal health and plant health, as Dr. Kirui so well put it. So I'm going to just wind up at this point. I thought that the One Health approach, it's about what, like 20 years or so in this part of the world, in this iteration, but it's something that was there 100 years ago. Somewhere along the line, people narrowed down into clinical. And I think what COVID is doing is making us realize that we cannot be narrow focused people in terms of the way in which we approach human health. Now, the challenge for anybody who's trying to practice is how to transcend, how to be in your discipline, but also to transcend across. And so the conversation that needs to happen is that, and I think that's one of the reasons why a platform like this is great, is if I'm going to be working in one area, how do I fully engage with somebody in another area so that we make sense of what is going on? So there needs to be a lot of data sharing. There needs to be a lot of definition of terms so that we know that we're talking about the same thing insofar as what the kind of research and the kind of practice that we're trying to do. And the challenge I see, in concluding, the challenge I see, and this is for me what COVID has brought out, is that we cannot adapt wholesale something that has been done elsewhere. Now, this is a tenet of health systems research, in that when you get something that has been approved elsewhere, you have to think about the context that exists in our environment. And that's the research that needs to be done. And often it is just different. So neither is superior to the other, it's just different. But if you just take wholesale, anything that comes from somewhere else and not think about the local context, then chances of failure are very, very high. So thank you very much, Christine and team.
Thank you so much, Dr. Ayah, for your amazing presentation. We have really learned a lot, and your work has continued to inspire us as students, as well as all the professionals who are on this platform. We are truly, truly grateful to you for taking time to really break down the specific issues that we're facing at hand and really give clear direction on what should be the way forward when it comes to handling the COVID-19 pandemic with while keeping in mind the One Health approach. Thank you so much. Thank you. So we would like to once more reiterate that there is an opportunity for all attendees of the webinar to be part of a small working group. Okay, so maybe you're asking yourself, what is this small working group? So basically, we saw the need for students to just create awareness on emerging zoonotic diseases in the past and present, and to further just educate the masses on the importance of the three major components of One Health in preventing future outbreaks. So we came up with the amazing idea to have a small working group that will be involved in developing an informative document containing credible and summarized information on zoonotic diseases that have either caused endemics or pandemics, and evidence-based solutions using the One Health approach, of course, on how to end future pandemics. So this is a really exciting project that if you've been bored at home and looking for something to do and you just want to find something constructive, this is definitely the perfect opportunity for you to, get together with a multidisciplinary team of people from different professions, people who are studying different courses. We have those involved in public health, we have those students studying medicine, we have nursing students, we have so many different professions represented on this webinar, and every single one of you as attendees, all, I believe 143 of you and counting, are eligible to apply to be a part of our small working group. Okay, so a link has been sent to the chat box. You know, if you are interested to sign up, please go over to the chat box. You'll see the link to apply right there. And just in line with, you know, talking about a multidisciplinary team and collaboration and all that good stuff that we want to be involved in, we have a small Menti for you just before we go into the Q&A section. So I'm going to be sharing my screen in a minute. There we go. I believe you can see my screen. So today's question is, what are some of the benefits that you've enjoyed or would expect when working with other professionals who are not in your field of work or study? So if you're interested to join the small working group, you will be immersed into a multicultural, multidisciplinary team of amazingly talented individuals who you're going to be working with over the next 4 to 5 weeks on this exciting project. So maybe you can just tell us, you know, what are some of the benefits that you've enjoyed or would expect when working with other professionals who are not in your field of work or study. You can try and, you know, like minimize your answer to like a sentence or two. Just tell us, you know, like what are some of these benefits that you've enjoyed perhaps in the past working in a multidisciplinary team, or you would expect if you haven't been in such an environment before, which is fine because now you have the opportunity to do exactly that. So log into www.menti.com and use the code 913449 and tell us your thoughts. So I am currently sharing my screen. I believe you all can see it, if I'm not wrong. And you know, just tell us like a statement or two of what are some of the benefits that you've enjoyed or that you would expect when working with other professionals who are not in your field of work or study. Here we go. We're getting some responses. Okay, so it opens up your view on health to one that's not limited to your own course or profession. Thank you so much for that. It's true, you know, in the modern world whereby we are slowly or perhaps have already become a global village, you know, it's so important for you to be open-minded. And what better way to do this than to be immersed into an exciting project like our small working groups that allows you to just be part of a multidisciplinary team. Another response we have, working with other professionals would be really exciting as we can experience various different opinions and thinking patterns to achieve a certain goal. Lovely. The Englishmen were not wrong when they said that there are many ways to skin a cat. And you know, sometimes if you're just closed up to a specific line of thought, it can be difficult for you to, you know, just have that creative mind that is constantly looking for new ideas and new concepts. And so definitely being exposed to such a team will help to, you know, get your creative juices flowing while we are getting amazing responses. Let's see, a plethora of ideas and knowledge can be shared when working with other professionals. We have diversity of thinking, we have a better understanding of complex health problems and more holistic solutions. Wow, guys, if you have sent a response to this Menti, please go over to the chat box and sign up for the small working groups, because this is exactly what we need. I mean, you are the people that we need. Yes, you know, don't sit at home thinking, you know, am I qualified for this? Yes, you are. We want to hear, you know, what amazing ideas that you have. We want to engage with you. And I have another response here. You get to learn new things from different fields. Obviously, knowledge is not within a single person. Wow. And knowledge is not congenital either. That's a quote that one of my professors loves to use. And so thank you so much for your responses. kindly go over to the chat box, sign up for the small working groups. We are going to have an amazing time. This is one of the best ways in which you can use this season. You know, we've all been thrown into an unexpected season whereby life basically just hit pause. And what better way for you to do something productive than to actually, you know, be part of a small working group that is involved in coming up with solutions and just creative ideas on how we as students, as professionals from different lines of work can really be involved in coming up with solutions to end the COVID-19 pandemics as well as future pandemics. Wow. Thank you so much for all the responses that have come in and those that are still coming in. Again, I cannot reiterate this enough. You need to go over to the chat box, click on that link. Even if you're not so sure about it, you know what, it doesn't hurt to just check out the application, see what type of questions are being asked, you know, sleep over it, think about it, and you'd be surprised. This could be an unexpected blessing in this season to just learn and interact with your colleagues. I will stop sharing my screen now. Thank you so much for all the responses we've gotten and the ones that we are still getting. I am now going to hand over to my colleague to conduct the Q&A session. Thank you so much. Oh my, I think I forgot to introduce myself. Pardon me. My name is Ruby Oswere, and I'm a level 3 MBChB student at the University of Nairobi. And I have been very privileged and glad to be your host in this small mentee session. Thank you so much. Over to my colleague.
Hello, everyone. My name is Lucy Nduta from Moi University School of Dentistry, taking Bachelor's of Dental Surgery. And I'm going to be doing the question and answer session. So we will have different parts to this. We can be able to take live questions to the panelists, and we will also be able to have questions in the Q&A box. And I'll be able to read those questions and direct them to the our speakers for today. So you're free to post your questions to the Q&A box. Please let us have your name, where you're connecting from, maybe your university and the course you're doing, and then your question. Please try to have your question as objective or specific as possible. And you're also allowed to be able to, send your question to a certain speaker. So if you want your question to be addressed, let's say by Dr. Kirui, you can just say you want the question addressed by Dr. Kirui, or if it's Dr. Ayah, you can also do the same, and you'll be able to direct the question to them. You can also raise your hand. So I'm watching on the raised hand. So if I see a raised hand, I take it as an indication that you want to ask a question. So I think we can start this part of the webinar now, and I'll take one question in the chat box by Kaushik Divnash. Please forgive me if I mention your name wrongly. Some of the names are very difficult. And Kaushik is a second year MBBS student, and they would like to know, how can we develop a common platform for cumulative approach like human health along with animal as well as plant health? So I'll direct this question to Dr. Kirui. And if I can repeat the question again, it says, Kaushik would like to know, how can we develop a platform, a common platform for cumulative approach, like human health along with animal as well as plant health? So Dr. Kirui, please, I'd like a response from you on this question.
Okay, thank you, Duta, as well as Divyansh, for your question. Indeed, it is one of those areas that is still very raw for us and is in a way been one of the greatest challenge for COVID-19. There have been several attempts to establish working relationships that are targeted at interventions, especially around outbreaks such as pandemics, which we have seen. I remember in 2015, there was projection that we are going to have Rift Valley fever, very early vaccination of animals in Baringo area in Kenya meant that we stopped that outbreak from occurring. We have experienced in Kenya areas where, for example, vets have volunteered as epidemiologists to work through a common platform that had been developed earlier called Zoonotic Disease Unit. But has it been as fluid, has it been as beneficial as had been envisaged early? The answer is a big no. We have seen globally areas where, for example, vets have donated ventilators and really going to see how to even support in diagnostics because those are cross-shared skills and competencies as well as resources. Plant health has been one of the most critical around this time. In fact, somebody gave the mention that we never knew that farmers are the most essential healthcare service providers because it disrupted food supply. FAO, in summary, working together with WHO and OIE, have created platforms for engaging the three aspects. And so in a very big way, then all the other professional groups can link locally, again, regionally or internationally to take advantage of such interventions. I know, for example, that sharing of data like Dr. Ayah, and thank you for your presentation, has put it, is very critical around this time because there's a lot of research that sits and can be shared. Thank you.
Okay, thank you. Thank you a lot, Dr. Kirui. So in the meantime, I'd like the host to unmute Jane Muthoni as we take one more question for Dr. Ayah. And then after that, Jane Muthoni will be able to ask your question live. So I'll take one more question for Dr. Ayah first, as you prepare to be able to bring your question live. So once you are chosen to do your question, please unmute yourself. I'll say your name first, unmute yourself, ask your question, then mute yourself back again, and you'll be able to receive a response. So before that, I have a question for Dr. Ayah. This question is from Rael Unditi. So Rael asks, so since we really don't know how much about COVID-19, is it okay to also think that it is a biological weapon and it can only be controlled if the country involved in manufacturing it gives out full information? So this question, I would like to send it to Dr. Ayah. Can we please get a response from you? Thank you.
Okay, so that question is in two parts. So one part of it is the bit about, is this a biological weapon, which I think is a bit of conspiracy theory, and I think it actually is answered by what we're trying to do here as One Health, which is that it's really critical that we have a good understanding of diseases in our region and where they come from and how they interact. So a lot of times in the absence of good information, people begin to speculate. Now, whether something has been created or it's come out of wherever it's come out of, like an Ebola and so on, the fact is that it is here and that we have to deal with it. And that calls for us to have the proper research. Now, I happen to have started practicing just when HIV was hitting. And believe you me, the stories were exactly the same. People were speculating and saying, yeah, somebody has created a virus just for Africans and so on. Now, as time has evolved, people have begun to understand what it is and where it has come from and so on. And that bit has sort of quietened down because it's been established. and people are focused, then what do you do? You know, who is susceptible, and how do you ensure, from an ethical and also looking at vulnerable populations, how do you ensure that you protect the population? Thanks, Nita.
Asante sana, Dr. Ayah. So now we will take a live question. The first live question, we're getting it from Janet Muthoni. Janet, please unmute yourself, ask your question, and we'll be able to get a response. Thank you. Janet, the floor is yours. Yes, Janet. We might be having an issue with getting that question, so I'll go on to another question as we wait for her to be able to ask a question. Anusha Gade, also an MBBS student from India, has a question to Dr. Kirui. So Anusha wanted to know more about the applications of One Health towards the COVID-19 crisis. They wanted a little bit more explanation on the application of One Health towards the COVID-19 crisis. So Dr. Kirui, a comment from you, please.
Okay, thank you, Anusha, for that nice and probing question. And I believe the whole purpose of holding this webinar is to really trigger us to think around how can we apply One Health concepts towards understanding and maybe even responding to COVID-19 crisis. And the first step in every other new pandemic or every other new disease that shows up is really to get the biological description of the disease and look at what are some of the drivers that could have led to its outbreak. So then, is it coming from wildlife? And if it is so, then what information do we have from wildlife health specialists, from ecologists, from conservationists? And that already is starting to point to you how we can utilize One Health. One, looking out for professionals who have information in one or another who can support understanding and design of interventions. The next approach is it becomes critical at this time, especially when you have COVID-19, to look at the resources that are available. And if we look at, for example, veterinary medicine, we had significant contribution of resources. And so you look at the resources, I think there's some background nice, but we'll still proceed on. So there are resources that can be utilized, which exist in different professions. One of the innovations that really needed to be thought through was air travel. And so there needed to be a lot of borrowing of experience in management of laboratories and infection control. And now we have HEPA filters being fitted in airplanes to facilitate travel. We also needed to understand the virus and how it can be disinfected, how it can be controlled from spreading between populations. And a lot of sociologists have also helped in shaping those interventions. So in a nutshell, One Health and the role it plays in COVID-19 is growing. It is for us to ask ourselves, with the benefits of One Health approach, how can we utilize it? One of the strengths it has is disaggregated approach. So communities have different ways of approaching it, depending on the resources, depending on the challenges, and depending on where they really are. So that, for me, is a summary. And it's for you to challenge yourself to look across the board, and sometimes you get innovative ideas coming in. Thank you.
Thank you, Dr. Kirui. I'll only take just one question, a live question. This one comes from Katumba Joseph. Katumba, please unmute yourself and ask your question. Katumba Joseph, it's your chance to ask your question live. Okay, we don't seem to have a to get just okay.
Okay, maybe as we wait for Gatumba Joseph, maybe I can ask my question on behalf of the panelists. Maybe one to Dr. Ayah. About Dr. Ayah, I want him to comment on about health innovation. So what is his take on health innovation towards the COVID-19, maybe from the various disciplines that you have stated? So what is your take, or what are some of the progresses? And then maybe for Dr. Kirui, one question. So far, is there something like animal-human transmission? And if there is, what is the status to it so far? How are the control measures or anything about it?
I think I want to allow Dr. Ayah to go first.
Okay, no problem. I think the question was about what kind of innovations are required. Now, I showed that schematic of health systems, and we need innovation right across almost every building block. So I'll just pick a couple of examples from a discussion I was having today. The current cost of testing is something in the region from $50 to $100. And a lot of medicine is controlled by, there's a lot of intellectual property around a lot of medicines. Now, it tends to be that particularly clinicians are not too concerned about cost of healthcare. It's a huge problem. And the mantra has been, oh, we need to do testing in order to determine the prevalence and what have you. Now, at $50 to $100 per test, a country like ours simply cannot afford to test. Even if the tests were available, we cannot afford it. So we cannot follow the route of developed countries of doing 100,000, 1 million tests or whatever. We just will not do it. The example to give is our HIV program is almost entirely donor funded. If we were told today to start to manage our HIV patients, the 1.5 million people with HIV, that would be more than our entire health budget. So we need to innovate. And the people who need to do that already exist. We have people trained in microbiology. There are techniques that are being used for PCR and so on are known. It's not a secret. So we have to figure out a way to manage COVID-19 given our resources. So we have to crack that. So it starts off at $50, $100. It will have to move down to, like Senegal is doing the dollar test and so on. That's where we need to be going. Even $1 is probably still too expensive. So there's that kind of innovation. The second one is around even just a social innovation. So we're talking about, we have slums here, Kibera, Korogosho, whatever. We have to have a different approach to social distancing. We have to get some innovations around that. So the kind of innovations that we need to think about in terms of health, they range depending on our context. But the bottom line is that we really have to think about how to do this cost effectively, because we cannot just we're not a China that has manufacturing capacity and can go from not making PPEs in one day to making millions of PPEs in a week. That's what China did when the crisis broke out. We still can't do that. We're barely making masks. So we start off by saying everybody will wear a mask. The cost of a mask is expensive for our population. So I'll stop there just to say that we need thinking right across. Literally any guideline given by WHO needs to be broken down, and the minds are here listening. You need to take that, interrogate it, and say, how do I innovate this to meet our local population? Because it's something that has come from a study from somewhere else. Some of it you can take the way you take an aspirin, most of it you cannot.
Thank you, Dr. Ayah, for that. I think probably I'll answer mine. And the question was whether there have been demonstration or evidence that SARS coronavirus 2 can move between humans and animals. And indeed, data has proven, based on phylogeny, that it could have come from the bats and possibly through pangolins. But more critically, that not only is it transmissible between humans to humans, but also it can be transmitted back from humans to animals, as had been evidenced by domestic cats as well as wild cats in the zoo in the US. And so that question really has been answered for us. The big question is, how has that evolved to become efficient as a transmission mode? And I remember even as COVID-19 was evolving in Kenya, the next question was, for the homesteads where there have been reported patients, are we screening for pets within those homesteads? And the answer was no. Are we providing information that relates to how humans are supposed to interact with animals once they have been diagnosed to be COVID-19 positive? And the answer again was that information is very scanty and is very limited. And really, even if you look at the briefs being given by the Minister of Health, there is limited contribution from other sectors that could also maybe give beneficial input, such as veterinary services, such as agricultural services, that goes on to give us other management that helps in controlling COVID-19. Remember, even markets where we get foodstuffs and the health interventions, especially public health interventions that have been put in place, have been far outstretched. People in motor vehicles are now selling vegetables on the streets. And are they inspected? Have they been trained? And most of those have they been tested? That again becomes a great challenge. Thank you.
Thank you, Dr. Kirui. I think that's all for the question and answer session from the attendees. Sorry for the questions that we've not answered, but for the questions that are in the chat box, in the Q&A box, I would like to direct our speakers there so they can be able to type the answers as we go on. Thanks again. My name is Nduta from Moi University Students One Health Innovation Club. Thank you.
Thank you.
Hi, Asir.
Hi, we can have Ruby. Ruby?
Hi everyone, I'm back. So I would just want to give a vote of thanks to everyone who has attended today's session. We are now in the tail end of our session. So to all of you 137 attendees who have, taken your time on this lovely Saturday afternoon, or maybe if you're in a different time zone, whatever time it is where you are, thank you so much for, investing in your knowledge and in being here today. We really appreciate. This was organized by the MSAKE COVID-19 webinar series, which is an activity enrolled under the IFMSA, CDC, and medical education systems. We would like to extend a huge thanks to One Health Kenya, that is both the UON and Moi University divisions of One Health Kenya. And we would want to extend a huge thanks to Daktari Online. They are the East Africa's leading online medical resources center. So guys, please check out their website for online medical references, CPD activities, and other amazing top-notch content. They've been in existence for about 3 years now, but this is definitely where you need to be, whether you're a medical student, whether you're a healthcare professional. Be sure to visit Daktari Online. We would also want to thank the MSAKE Task Force, of which I am a part of, under the able leadership of Yasir. Thank you so much for being such an amazing leader and helping us to organize these fantastic sessions. We would like to extend a huge thanks to our speakers for today, Dr. Kirui and Dr. Ayah. We are truly privileged to be in your presence, virtual presence, but still, it is an honor that you have graced us with your knowledge and with your wisdom, and we have definitely learned something from this, and it will be beneficial for us moving forward and just in the quest for knowledge and the quest for enlightenment when it comes to this particular topic. We would also like to give a special shout out to Pavan Raj for making our promotional videos. They are always just extremely high quality, top notch, and we just want to say thank you so much for that. Now, finally, guys, as I had mentioned before, we are having a small working group. So the link to that will pop up on your screen once the webinar ends. And furthermore, you can also check out the chat box to see the link to apply to be a part of the small working group. And all attendees, every single one of you, are eligible to apply to be a part of the small working group. And in addition, all the attendees will receive certificates upon completion of our feedback form. So the feedback form is different, right, from the application for the small working group. So the link to the feedback form will also be shared. So if you want to get your certificate, just to, prove that you have attended this session, please be sure to check the chat box, and you should be able to see the link for the feedback form. And furthermore, we are also going to thank Samantha. She is part of the One Health Kenya team. Samantha, thank you so much for partnering with MSAKE to help us organize this amazing webinar. And now, for a few more minutes, about 10 minutes or so, we are going to have some more questions, right? Just a short run through the questions that we weren't able to go through. So if you can stick around just for a few more minutes, we'll be able to address a few more of your questions. But once more, thank you so much for being here. I would want to share the link to the feedback form once more, sorry, or I believe, okay, just a minute. Yeah, the link, yes, it's coming through, just a second. There we go. Check the chat box, you should be able to see the feedback form right there. Please remember, you need to fill in the feedback form so that you can be eligible to get your certificate. And then if you want to be a part of the small working group, there's a link for that as well. So the link to the feedback form has been sent to the chat box. Thank you so much, Yasir, for helping us with that. So that is it for our vote of thanks. Now I can hand it back over to Lucy to run through a few more questions before we end today's session. Back to you, Lucy.
Hello again. Thank you, Ruby, for that. We still have some more questions in the Q&A box that we'd like to take. We don't have so much time. We have like 10 minutes, so we can take 1 or 2 questions. And I would welcome short comments from Dr. Kirui and Dr. Ayah on these questions. So I'll start with the first question. It is from Tatuoil. They wanted to know that One Health seems to be so much like public health, which many medical students are not so much interested in. And they wanted to know what can be done to make more medical students interested in One Health. So I would welcome a very short comment from Dr. Kirui, and then we can have another comment from Dr. Ayah. Thank you.
Yeah, I think I want to appreciate my co-presenter, Dr. Ayah, who mentioned the fact that One Health approach initially was the key concept even in training, even in community practice. But we lost it over time as we tried to sharpen the different professions, what we called building pillars. And we built such strong pillars, but we forgot to connect them. And so to get more students to be interested, we believe that exposure first to data that shows support that as a doctor, why should I look at a veterinarian controlling diseases in animals? If you don't, you're going to get COVID-19 coming to your clinic and most likely affect you as well. The next is, as a practice, can we encourage professions, especially at the young stage of development, to interact together so that they know what the other profession can contribute, probably what the other specialty, to the extent that they know they can work together and improve outcomes of patients and probably health of communities. So it is indeed from sharing of experience. It is indeed from utilizing systemic approach that really help you to meet. And if you really had every doubt, Dr. Ayah today is your testament, having had his MD degree and going on to interact with public health. So welcome for those of us who are willing to join. Let's all become practitioners of One Health. And thank you for attending this very interesting webinar.
Thank you, Dr. Kirui. Dr. Ayah, please, a comment from you.
Yeah, I was going to add something, perhaps on a more personal note. One of the privileges of going to university is that once you've been to university, you're a notch up in terms of the general society. And so really earning a living is not going to be a problem on average given time. And
Dr. Ayah would like a comment from you on what can be done.
Yes, can you hear me?
Yes, we can hear.
Yeah. So what I was saying on a personal note is that you then have to interact with life. And I practiced in clinical medicine for about 15 years, but something that Christine didn't tell you is that my first degree was actually in systems management, and I dropped out in order to do medicine. So that's where the systems bit sort of comes in. And one of the things that you realize, and this is for me why something like One Health is important, is that as a doctor, as a vet, whoever you are in whatever you're doing, you're interacting with the rest of society. And already you have the brains to solve a lot of problems, and problems never come in simple form. They come complicated because of society. And so you have to figure out how to solve those problems. And this is one way, one very good way of solving some of those problems. One of the frustrations of doing sitting in a clinic for me was you sit and patients come with all kinds of issues. And then you have to go back and ask yourself why. So for example, right now in the last few months in Mombasa, there's been an outbreak of dengue fever. Now I practiced in Mombasa for a couple of years, and for the life of me, the idea that I'd been a private hospital managing dengue fever in 2020 is probably not why I went to medical school. I probably imagined, initially I imagined I'd be doing sophisticated cardiology and that kind of stuff. So the things that we have to solve, and we have to solve them now within what we can do. So we don't have the kind of resources where I can throw $100 million at a problem. That's not going to be our situation. So it really requires brains. So the way I think about it is that these difficult problems, they look so obvious on the surface, turn out to be so complicated, really require the best brains. And it requires that collaboration as well. So I'm not going to understand diseases that have been around for for as long as it can, unless I interact with others who are also looking at the disease from another perspective, because clearly the direct way has failed. The one where you say, let me just throw drug X at it or whatever, that has not worked because we're where we are. So it's something that I feel that it may be a thing that evolves with time, and I think people on this platform are very lucky to get some of this, to get that opening in terms of thinking very early on. I think that the easy way out, and I've got colleagues who are top in what they do, insofar as whether it's in medicine or in law and so on, and you can make tons of money, live very comfortably, yes, but there's some people who also have that intellectual curiosity to try and solve societal problems. So I'm comfortable, I don't have any issues, my family does not have any issues in terms of money and so on. The problem is now when I look at my wider family, when I look at the community, then I begin to see problems that need to be addressed. And they cannot be addressed by handouts. They need to be addressed by sorting out the system. So it is that system that we have to make safe for everybody concerned. Then I don't have somebody calling on me and saying, I've got a sick child with dengue fever, can you help me? In 2020, So thanks for that.
Thanks a lot, Dr. Ayah and Dr. Kirui, for those comments. That's it for this session. I would like to hand it over to Yas, just to tell us a little bit more, Yasir, a little bit more about the small working group, so that people can apply even as we conclude. Thank you. Yasir?
Thank you very much, Lucy. Thank you very much, Dr. Ayah and Dr. Kirui, and all the attendees who have attended. We are really grateful also to have this opportunity to learn. For some of us, we didn't even know what One Health is, and now from today we do know the importance of One Health and and the importance of looking at health from different perspective and not at just one angle, because health can cut across various sections. You'd even be surprised that the plumbing system in your home is related to health one way or the other, and that's how the beauty of health, and that's why we need to look into health in various different ways. So there's an opportunity for all of you guys who had this really good introduction today in this webinar to join a small working group. So the small working group aims to increase the collaboration now between the different professions that we are all in today. And so we will be having medical students working with pharmacists, working with vet students, working with environmental scientist students. So you'll have that opportunity for that interaction. And it's basically coming up with a really good information document on zoonotic diseases. And we've seen that the COVID-19 is not the first zoonotic disease to scare the world. We've had many in the past, Ebola, HIV, Zika, you name it. And we just want to increase the awareness of, yes, this is One Health, and look, there's this one aspect of One Health, of the spillage from animals to humans, and it has really caused a lot of chaos around the world, and we need that One Health approach in order to prevent future outbreaks. So we're looking forward to your solutions, we're looking forward to your understanding, and this will also improve your knowledge on One Health. So watch out to just apply for the link, and otherwise, if you don't get the link after this webinar, please also do contact any of us and we will send you the link. Also, we just want to tell you a bit about the MSAKE COVID-19 webinar series. So the Medical Students Association of Kenya formed a task force that is going to fight against the COVID-19, and the webinar series is part of the task force. So this is like the 9th episode in the series, and it's registered under the International Federation of Medical Students Association under Communicable Diseases and Medical Education System, to ensure that medical students around the world are are equipped with knowledge on the pandemic, but now into further detail, and also building the bridge and getting to know who are the leaders in our society, like Dr. Ayah and Dr. Kirui, who are really well knowledgeable in this and have used this platform as an opportunity to share that knowledge. So that is our major goal, and through the IFMSA, we're able to also share this opportunity with all the students around the world. And we also hope to continue doing the same work, hoping to end the pandemic through community education and empowering ourselves, as we will be part of the health system in the future, and we are future global health leaders. So thank you very much once again, Dr. Ayah and Dr. Kirui, and the team, the collaborative team between One Health and MSAKE, the One Health led by Samantha. Thank you very much for that effort. And also in organizing this wasn't easy. It required meetings, online meetings, and a lot of logistics before. So thank you guys for pulling this up together, and we hope to organize more sessions and see you guys also attend our sessions, and as we continue with our motive. Asante sana. Also, thank you very much, Dr. Online, for allowing us to use your amazing platform and also empowering medical students in order to, just spread the knowledge and also gain knowledge simultaneously. So, asante sana. Asante in Kenya means thank you. So, for all those who are not conversant with Kiswahili, so thank you guys. Hakuna matata. Have a good afternoon or a good day. Bye-bye. Thank you.
Yeah, thank you very much, everybody.
Thank you.
Thank you, everybody, and have a blessed day, and stay safe.
Thank you. Bye. Have a good day.
Thank you.
Samantha, would you like to say something, Samantha?
Hi, yes.
Hi, Samantha. Yes.
How do you call my name?
Yes. Would you like to say something? Anything about Oshea or Sohik, Kenya?
Well, there's someone who's asked.
I'm asking.
And it's okay. It's okay. I think we can talk more later because right now I'm even just walking. But I like the idea of the small working groups. I think it's something that we can explore immediately. I know the One Health community is continuously expanding. So even as you raise the issue of OSHA, where initially we've been having these 3 colleges, College of Health Sciences from UON, then CAVS, then of course MOI. We're expanding to accommodate more individuals from different fields so that we also just have, like you've said, that One Health lens. Yeah.
Thank you, Samantha.
So I hadn't really heard your question. I hope I've answered it. I was quite far from my laptop.
Yes, you actually did. It was just
but it's okay. It's okay. Thank you.
Would any of the attendees like to say anything? Anyone?
Hi, Yasser.
Hi. Okay. Thank you. Karen?
Oh, yes. Hi.
Hi.
When is the deadline for applying for the small working group?
So the deadline for applying will be Monday night, so 23:59 GMT.
Okay. Thank you.
Thank you.
Hi, Yasser.
Yes.
I'm not so sure if Nyambura is in or someone from Daktari Online and how long we have the platform, but I'm seeing we have 45 participants and I'm seeing Dr. Kiru is still in.
Yeah.
And I don't know if probably also Dr. Kiru can mention if he can take any questions from, or if any of those 45 participants have any questions, they can still ask. Yeah.
Yeah, that's fine. We can delegate some time, some few minutes for some questions. Yeah. So would anyone like to ask any questions as we close the session? One Health is very interesting. So there's a lot.
Anan from Karen Gia.
Karen, okay. Karen, you can go ahead.
No, I already asked my question.
Oh, okay. Anyone else?
So probably we are just clearing on the questions that have been typed. Yeah, for about 5 minutes, we might try and manage to answer those who are online. Thank you.
There is Gatumba Joseph.
It's okay. I think there are no more questions if I'm not wrong.
Okay, if there are no more questions, we can end the session. Thank you. Thank you very much, guys. Thank you. Stay safe and have a good day. Don't forget to fill the feedback form and apply for the small working group. Good day. Bye.